Okay, hi everyone. Thanks for that introduction, Jennifer, and thank you to the Parkinson Society for having me. Like Jennifer mentioned, I've been a pharmacist for a number of years now, so if my 20-year-old self would have suggested that at some point in my career I'd be speaking to a group of people about cannabis, I probably would have laughed out loud. But my 40-year-old self thinks that I very much need to be here talking to you about cannabis. And probably my 20-year-old self also wouldn't have believed that my phone would be smarter than me at some point, but so it is, and here we are. And we're going to talk today about cannabis. Like Jennifer had mentioned, I'm really passionate about working with patients, and I'm also really passionate about good science. And that's where I think the cannabis industry really needs us to work together. We need to talk about these things as healthcare professionals and as patients so that we can have good conversations to make sure that what you're doing for yourselves is safe, it's effective, and really we all come out with good outcomes in the end. So hopefully over the course of the next 40 minutes or so, I'll be able to kind of present some of that information that I hope you go out and spread. I think it's important to be spreading good information about cannabis these days. Like Jennifer mentioned, I work for medSask, so we are a drug information service out of the University of Saskatchewan. We answer drug information questions for healthcare professionals as well as consumers. So I brought some information here. Certainly give us a phone call if you have specific cannabis questions. Most of them come through me. I'm happy to take your questions through medSask, so absolutely look to us for some drug information. This is my disclosure slide, just really quickly. I'm not paid by any cannabis companies. I don't have any interest or stock, so I really don't have any ulterior motives in speaking to you about cannabis today. I wish I was paid. I'd probably, yes, be in a better position, but it is what it is. And currently I don't have any research funding either. So those are my disclosures for the day. I will be providing the slides after. I find that sometimes I tweak things and provide extra information after a presentation, so that this information will be available to you after this afternoon. And also, I apologize, these slides are small, so I'll try to read most of them to everyone that's in the back of the room, and once again, they will be available to you after. So I think when we talk about cannabis, it's important that we start talking first about the endocannabinoid system. Now, has anyone in this room heard of the endocannabinoid system before? Todd? Keener? Anyone else? Yes? A few hands here or there. This is really fascinating to me because I went to pharmacy school, I spent 6 years in university, and I never heard a thing about the endocannabinoid system. Now, part of that probably is because it's really only in the late 80s and early 90s that we started to learn about it. But it's actually physiologically part of our body. So in the way that we have a nervous system, and a muscular system, and a digestive system, we actually have parts of our body that work with cannabinoids or cannabis, the products that are in the cannabis plant. So I think that's really fascinating that our bodies are made to use these products. So like I mentioned, the endocannabinoid system is a biological system. Its biggest function is what we call homeostasis, which is our big fancy science word, which I have to note that the Parkinson's group, you guys have a lot of big fancy words. I spent a lot of time in Google looking up dyskinesias and bradykinesias and all sorts of things. So anyways, the endocannabinoid system is all about homeostasis or balance. So it's just keeping us regulated. That's what it's all about. So when we have something that excites us, our endocannabinoid system kicks in to kind of bring us back down. That's what it functions as. There's several major things in our bodies that make up this endocannabinoid system. So we have all these little receptors throughout our body. In addition, we actually have what's called endocannabinoids. So those are little chemicals, little neurotransmitters that float around that are similar to what we're getting from the cannabis plant, but they're natural to our body, and that's what works on those receptors. In addition, we have all the enzymes and things that make up and break up. What I think is very interesting is there's a complex link between this endocannabinoid system and Parkinson's disease. And what's unfortunate is, given that we've only really known about this system for, since the 90s, I don't think we know a lot about what it's doing in Parkinson's disease. So I've read some studies that say in a Parkinson's patient that this endocannabinoid system, there's more of those endocannabinoids, there's more of those receptors, but I think that it's really important for more research to come so that we truly understand how the system works, and then therefore how we can tweak the system to make it work better for our patients and to have a clinical effect. And there's kind of this suggestion about whether or not the endocannabinoid system is compensating in people that have Parkinson's disease, or whether it's actually contributing to it. And once again, that's going to affect how we tweak the endocannabinoid system to help people with Parkinson's disease live better lives. Now, I'm not sure if you've heard of some of the things, but probably, I think, given the information we know about recreational cannabis, these are many of the functions that the endocannabinoid system has in our body. So absolutely, just from what you've heard, you could probably say that cannabis and the endocannabinoid system work on inflammation, pain, appetite. We hear about people on cannabis getting the munchies, right? So we can identify those processes. But I think it's also important to note that regulation of stress, the endocannabinoid system is involved, wake and sleep cycles, reproduction. There's many other systems that the endocannabinoid system is involved with. That's important to note. And what I also think, it's important to realize that when that endocannabinoid system isn't working well, that is actually related to things like certain types of cancers, certain types of neurological conditions. So when it's working well, it's great, but sometimes when the endocannabinoid system isn't working well, there's certain functions that occur. So let's talk about cannabinoids. Now, lots of big words that we're going to be using today. Cannabinoids is probably one that you've seen floating around if you've looked at all into medicinal cannabis. And really, what is a cannabinoid? So technically, it's been defined as anything that's closely related or chemically related to THC. Now, there's a couple of different cannabinoids. So we talked about endogenous, or the ones that are in our bodies. So those are the ones that we have circulating around our bodies. They're natural to our system. There's phytocannabinoids, or plant cannabinoids. So when we have a conversation about medicinal cannabis, we're speaking to phytocannabinoids. I probably don't necessarily need to highlight THC and CBD, but those are certainly the terms that are floating around when we're talking about medical cannabis. So those are two of the phytocannabinoids. And then there's also synthetic cannabinoids. I'm not sure if you're aware of this, but there are already drugs on our market that are cannabinoids that work on this system in our body. So we have some prescription versions of it. There's also been some drugs that have been on the market and subsequently removed because of some serious side effects. So certainly we've been working with this cannabinoid system in the past, and not just with medicinal cannabis or phytocannabinoids. So it's important to be aware that there's a couple of different chemicals that can tweak this endocannabinoid system. So let's talk a little bit about the cannabis plant. And the cannabis plant is fascinating to me, and I think part of it is because the female cannabis plant is the real workhorse. So that's where we get all of these cannabinoids from. I think as a female, I take a certain amount of pride in that. Anyways, the cannabis plant, there's several different species that are out there. So cannabis sativa, indica, ruderalis. Like I said, there's male and female plants, but when we're speaking about medical cannabis, it's really those female plants that we want. The reason is they're the plants that make the most cannabinoids. And those cannabinoids, so the THC and the CBD, is what we want to take from that plant to have the medicinal effect. Fascinating to me that this plant contains more than 700 chemical components. So it's a complex plant. So we're taking a potentially complex body system and a complex plant in people that have complex conditions, and somehow we want all of this to work magically well to have a great effect, which I hope you can understand that can be complicated. So more than 700 compounds. Of those compounds, there are things other than those cannabinoids that I mentioned. So there's something called a terpene. I'm not sure if you've heard of a terpene before, but that's what gives cannabis its characteristic skunky smell. It's a terpene. There's other terpenes, and I have a quick slide that will talk about more terpenes, but they're quite interesting because they've been shown to have some effect on the body as well. So it's not necessarily just the THC and the CBD that are having an effect. There's flavonoids, sterols, alkanes, so many different chemical components that are potentially in this plant. Of those phytocannabinoids that I mentioned, so THC and CBD, they've actually found over 100 of those in the cannabis plant. So we know quite a bit about THC and CBD, but there's 100 other phytocannabinoids that really, I think there is more work being done on them, but a lot more to know about this cannabis plant than what we know. And this is part of what compels me to continue to want to learn more about cannabis, because the more you hear, the more I talk about it, it's fascinating to me, and I think the potential absolutely exists, and it just keeps me wanting to learn more about it. So that's why I wanted to share a little bit about the cannabis plant with you. Now, one of the things that I get a lot of questions about is cannabis strain. And if you talk to anyone that's using cannabis, if you happen to pop into a recreational store, if you've been online and checked out any of the cannabis suppliers that are out there, they're going to talk about these different strains. So sativa and indica. There's different names for recreational supply like Purple Kush and Pineapple Express. And for people, when we're having a conversation about medical cannabis or cannabis for medicinal purposes, I think that we need to move away from this strain conversation and talk more about what's actually in that product in terms of those cannabinoids. So how much THC is in this product? What percent? How many milligrams or grams am I going to get when I use a drop of oil or a puff from a vaporizer? That's what we need to talk about. And in fact, they've done some research in these strains, and the research doesn't say that, that strains are very particular to certain plants. So it's not like apples. You go to the grocery store, you buy a Fuji apple, you know that that's what it is. Whatever the other apple, those are specific strains. They're individual, distinct strains. With cannabis plant, over the years, they've kind of started to mix. So what I'm trying to say is if you buy a certain strain today, and let's give it the name Pineapple Express, that's not necessarily the same Pineapple Express that you'll get from another store or another supplier. So like I said, I think it's important that we talk more about the concentrations. And especially as a healthcare provider where I'm used to dealing with milligrams and doses, I'm particularly passionate about this. I think that we need to if we're going to use it as a medicine, we need to make sure that we're speaking on those technical terms. So let's go a little bit further into phytocannabinoids. Just from the questions that I get at medSask and the conversations that happen around my kitchen table, I think that there's a lot of interest in phytocannabinoids. And whether or not the legalization of recreational cannabis has motivated this, who knows, but it's important that we are talking about it as healthcare professionals and patients. So phytocannabinoids are mostly present only in cannabis. What I think is really interesting is the plant itself. You can't just grab a cannabis plant, chew it, and think that it's going to have effect. So if you ever are shopping, I know in the US they have a whole variety of products that aren't quite legal in Canada yet, but juicing a cannabis plant is probably not going to have the effect that you think it's going to have. You actually need to heat the chemicals that are in that plant to turn them into the THC and CBD. So that's where typically we've seen cannabis having to be smoked or vaporized. Now what's great is that a lot of manufacturers have taken care of that process. So they heat the plant and then put it into an oil or a capsule. So you don't necessarily have to smoke or vaporize a product now. You can take it as an oil or as a capsule. But just be aware of that. And I think as legalization changes and based on what we've seen coming from the US, there might very well be a juiced cannabis product at some point. But if it's just the plant and they're juicing it, it's probably not going to do that much for you. So that's essentially phytocannabinoids. Now the two big ones are THC and CBD. And I wanted to speak a little bit about THC and CBD because those are what you're going to be identifying if you're going to choose to use a cannabis product. So THC is what's been associated with euphoria or kind of that high that people experience. Clinically, or what we see for medicinal purposes, it's shown some use in spasticity, in neuropathic pain, in controlling nausea, and stimulating appetite. Now CBD, we know we know a lot more about THC than we do about CBD. But I think there's a lot more buzz that's starting to be generated about CBD. We're seeing a lot more research involved. So I think we're going to start to learn more about CBD. But at this point, we know, like I had said, a lot more about THC. CBD is not associated with that euphoria. So you don't get high from CBD. And in fact, a lot of science has said that it might actually help to oppose THC. So if you take plain THC and let's say you take 10 milligrams of it, you might be high as a kite. If you add a little bit of CBD to it, it might help to kind of offset that euphoria that you experience. Some of the clinical uses of CBD, and once again, we know a lot less about CBD than we do about THC. So some of these clinical uses come from test tubes and from animal studies and not necessarily human studies. But it has shown some effect as an anti-inflammatory, as a pain reliever, possibly working on anxiety and helping to control anxiety symptoms. Certainly as an anticonvulsant, and CBD is a prescription product in the US. It's called Epidiolex, and it's for seizures. Antipsychotic, and even some antiemetic or anti-nausea symptoms. So definitely some promise in CBD and some work to be done. But even in knowing how they work with that endocannabinoid system, THC, we have a much more clear picture. With CBD, it's tricky. It works on so many different systems in that endocannabinoid system that I think a lot of research needs to be done before we fully understand how CBD is working in the body. I'm keeping an eye on time. I'm notorious for speaking over time, so I'm going to try to keep this in control. So I did mention that that plant has over 120 cannabinoids, so certainly there's other phytocannabinoids that are in various stages of research. So we might hear more about the cannabis plant other than just THC and CBD. And that slide, it's really small, that picture in white, but that's some of the therapeutic effects that they've shown with some of these other cannabinoids. So you can see that the potential for use of this plant is pretty significant. Like I said, I feel like there's a lot of work to be done to really use it to its full potential, but absolutely the potential exists. So one of the things that I've heard a lot about when we talk about cannabis is this thought that maybe it's the mixture that is the medicine. So it's not just taking THC or CBD out of it, but rather all of that plant. So that 700 different chemicals and that 120 different phytocannabinoids, that somehow there's something to be said for the combination, and this is where science needs to support that. So terpenes, part of that plant that gives it the smell, this is one of the other things in the cannabis plant that might be having the effect. Terpenes are not unique to the cannabis plant, so a lot of other plants have terpenes in them, and even by some of their names, like pinene and limonene, you can kind of already suggest what they smell like in other plants that might contain them. Once again, you'll see this slide in your slides once you receive them, but there's certainly some physical effects that they have shown that these terpenes have, and then there's potential benefits. So if you go on the internet and start to look about terpenes, or if you go into maybe a recreational cannabis store, they might speak a lot about terpenes and the terpene profile, and I just am not convinced that the science is entirely there, but I think we need to be mindful of it. I think that they're a significant player in the game. The other thing to talk about is what's called the entourage effect, and I kind of already alluded to this. So the fact that it's maybe not just the THC and not just the CBD, but rather all of these chemicals together that are having the effect. And there's been some science that has supported this, also some science that says maybe not. But we also need to think about that when we're thinking about the cannabis plant. So I use my example as the Golden Girls. I think that each of those personalities on their own are fiery and have their own characteristics, but you put those four women together and it's an entirely different ballgame. So that's what I like to think of when I think about the entourage effect. Once again, a very small slide, but this just shows you the different formulations that are available for using the cannabis plant at this point. Now, legally and recreationally, right now the dried product and oils are legally available. In the future, we're going to see concentrates and topicals coming onto the market in the recreational and medical stream. So certainly you can use that fresh product, that dried product, cannabis oils. These are more street terms, but I think when I'm speaking to other healthcare professionals, I've spoken to some nurses, we've been just talking about these terms, and I think it's important to talk about the concentrate. So you might hear terms like wax, or shatter, or buds. People are talking about dabbing, and this is very much coming from the recreational world. But for anyone that's considering using cannabis, I need you to be aware of what these terms mean. So if you happen to be getting a product that is wax or a butter, not legal yet in Canada, but will be in the near future, those products are highly concentrated. So from a capsule or oil, you're only looking at maybe up to 30% THC or CBD. Those concentrates are somewhere in the neighborhood of 90%. So they're really, really potent. It's like when you think of a concentrate that you're making a beverage out of. We used to always drink Hips drink when I was a kid. And so you get the concentrated product, and you had to dilute it with water to ultimately end up with your juice. So using those concentrates is like drinking that concentrated product. It's going to pack way more of a punch than the other products that are available. So as concentrates become legal in the next coming months, we need to be aware of exactly what product that we have. There are certainly other formulations that are around, so tinctures and sprays, some creams. I think that we need to have some more science in terms of whether or not a topical product is going to work. Just the chemical nature of those phytocannabinoids, they don't necessarily penetrate all the layers of the skin very well. So if you're putting it on your skin for a certain effect that's just a local effect, possibly. But if you're putting it on your skin and hoping that it's somehow going to work on your pain, I'm not sure that we're there yet, because it's tricky to get those cannabinoids through the layers of your skin. So it's going to take some good science to put it in a cream that's going to help the skin absorb it. I've also seen there's all sorts of things in the pipelines right now. So I've seen cannabis suppositories and topical patches, and I think as more interest continues and the science starts to advance, that we'll see some of these companies really coming out with innovative ways of using the cannabis plant. So let's talk about dosing. This is a big question that I get from our medSask callers. And if I had an answer to this question, I would be a multi-bajillionaire. But I don't. And the picture that I use, which for everyone in this room, it's kind of not a great picture for you to see, but it's very much walking into a tunnel that you're not quite sure where you're going. And I feel like that's where we're at with cannabis dosing. And particularly as a pharmacist, where I'm very used to seeing a prescription that gives me a drug that I know has been well studied for safety and efficacy, and a dose. I know you're taking 100 milligrams, you're going to take it once a day for 30 days, and it's going to start to work in about 2 weeks. I don't have that kind of dosing information with cannabis. So I very much think, and full pun intended, that dosing gets us in the weeds. It's a little bit of a sticky situation. So the best advice as a healthcare professional that I can give to my patients is to start low and go slow. So you're starting with a really, really small amount and gradually increasing it. And I find that with cannabis, there's a lot of variation in how people use it and side effects, so it's very important that titration, or how we gradually increase it, is very different from one person to the next. And this is part of the reason why I encourage anyone that's considering medical cannabis to use a healthcare professional. So use their physician, a pharmacist, anyone that can help them kind of navigate this dosing, because it's tricky. There's a few tips. The choice of cannabinoids, so whether or not you're going to use a THC product or CBD, depends on many factors. So not only does it depend on what you're trying to treat, but it also depends on the person that we're treating. And once again, there's a lot of variation from one person to the next. So if I'm going to use a product for a patient that maybe has a high risk of falling, I'm going to be very careful with THC, because THC can cause some symptoms, some brain symptoms, some fogginess, and that might increase your risk of fall. So it's very much an individualized approach. THC, some of the things that you might choose a THC product, so symptom relief. So we've seen it for spasticity, we've seen it for chronic pain. With THC, the analgesic effects of it, and this is where the nausea and the appetite. So certainly choosing a THC product, if you're looking for those symptoms, that might be where you go to THC. With CBD, you might choose CBD once again if you're not looking for the euphoria and some of those other clinical uses that I spoke to earlier. What I think is important to note, that even if you're using a THC product, you don't necessarily need to be experiencing that euphoria for it to be having an effect. So if you're using CBD for muscle spasticity, for example, you don't necessarily need to have that high feeling. They've found that some of the, what they call therapeutic doses, can be a lot lower than the dose that you need to take in order to get that high. So a recreational user is very different from a medicinal user. So someone using it recreationally is much different from someone that's using it for medical purposes. I think it's very important when you're first starting it to start off with a low THC, high CBD product. And Health Canada, in regulating cannabis, this is part of the reason why legalization has been a good move, in that we have a lot more regulation around what the labeling looks like on these products. So you're actually going to be able to see the amounts of THC and CBD in these products. So we've come a long way with that. So certainly looking for something that's low on the THC, high on the CBD, or is a 1-to-1. So the amount of THC is the same as the amount of CBD. The products that are high THC and low CBD, in my mind, are more for a recreational user or someone that is looking for a different experience from their cannabis. And once again, you change that dose every couple of days, as tolerated, and every patient looks a little bit different until you achieve that symptom control. And we're going to talk a little bit more about setting some goals. I think it's very important for patients and healthcare professionals to know exactly what we're signing up for when we consider cannabis, and to continually reassess it. So if you're going to use a cannabis product, let's have a conversation in a couple of weeks. Is it working? Is it not working? What side effects are you experiencing? Because at some point, if the risk of you taking it, so the side effects that you're experiencing, are greater than what it's doing for you, we need to talk about stopping it, okay? This is an important slide for people that have, when you're considering what type of formulations are available. And I've looked at some of the stats in the Canadian Cannabis Survey, and it surprises me that there's still a lot of medical patients that are smoking cannabis. And as a healthcare provider, I'm not going to stand up here and ever suggest that someone starts smoking cannabis. We know that there's a lot of health effects that are associated with it. Now, a lot of our research still supports vaporizing cannabis, just because of the science that we have is on a smoked product. But you need to know that they are very different. So for anyone that's ever been on a pain medication, where you have a short-acting version and a long-acting version, that's kind of like smoking or inhaling cannabis versus taking an oil or a capsule form. So the inhaled product works a lot faster, but it's short-acting, whereas the oral product takes a lot longer to kick in, but it tends to last longer. So for a patient that has maybe previously used vaporized cannabis in the past and they're interested in switching to an oral product, we need to make sure that they're aware of this. They're not going to get that same effect that kicks in right away. So that's important to note. And I think with edibles coming onto the market very soon, we need to be aware that when you consume a cannabis product, it takes hours for there to be an effect. So you're not going to notice anything right away. People that have been taking medications are very much used to this. But anyone that might be unfamiliar with that, they need to know that there's significant differences between the two. And I caution because, as I've mentioned, it's very important to consider individual patients. So in a Parkinson's patient, where we might have some changes to how we digest, and if that digestion is slowed down at all of these numbers are out the window, right? So it might take even longer or shorter for a cannabis product to take effect, or how long it's going to work. So. And I wish I had better evidence to say what that looks like, but I don't. So this is just kind of some general guidelines at this point. This is a slide that I put together, really small for people in the back, but Jennifer had kind of identified the conditions that are out there and whether or not I should be on THC or CBD. And really and truly, we don't know. There's many question marks on this slide. So if you're looking at anxiety and which product should you be taking, there's a certain amount of science that says that CBD might be a better choice, but quite truthfully, we're still needing a lot more information to help make these clinical decisions. So this is a really tricky part in trying to figure out, okay, here's what you want to use cannabis for, here's what you should be using, and then how much. It's complicated. If I haven't said that yet, I'll say it again. It's complicated. Many different products that are available, and this is certainly an example of where the industry, so the people that are making these products are the ones that are doing a lot more of the education. This is where I hope that cannabis kind of starts to shift gears a little bit, because right now it's all of the manufacturers that are putting out the information and putting out the products and are teaching about these products. And that's where I want to start to move to healthcare professionals and patients, that we have different sources of information. Obviously, if you're selling a product, the information that you provide might have a certain spin on it, right? Because at the end of the day, dollars and cents matter, unfortunately. So different products that are available, I put an example of what a gram of dried cannabis looks like, because for a lot of us, no idea. So it's about the size of a toonie. There's There are capsules that are available. When you buy the dried product, it comes in a little container, and then you can, once again, smoke it or vaporize it. I will always suggest to a patient that wants to inhale cannabis to use a vaporizer. So the next two pictures, the middle pictures, are vaporizers. Very expensive, $500 and up for some of these vaporizers. You can get little pens that are available now. They're a little bit cheaper, but a couple of different options there. There's oils that are available. There are capsules that are available. That's in the top corner. Obviously, you can't really see from just packaging. And like I had said, there is a certain amount of required information on a package now when you buy cannabis. And I think that that is a great move because when you buy that product, you know how much THC and CBD is in it. For anyone that is considering an oil, I think it's very important that we use syringes. So I'm a mom, I have a 3- and a 5-year-old at home, so I probably have no less than 100 syringes floating around. As a pharmacist, it drives me a little bit bonkers when my mom still comes with a teaspoon, which I know it is what it is, but I think it's very important to use medicated syringes when you're using a cannabis product. So a lot of the products come with a dropper, and a producer might say use 1 drop, use 2 drops. I want people to get in the habit of actually measuring that dose so that you know, okay, I'm taking 1 milliliter or I'm taking 0.5 milliliters. That way we can do a better job of changing that dose when we need to. These are the prescription products that are available. So I did mention that we actually have cannabinoids that have DINs or prescription numbers. So Sativex has been around for a number of years now. It's for MS patients that have spasticity. It's THC and CBD in a spray that you spray under your tongue. And certainly I've seen people prescribe Sativex for things other than MS spasticity. It's what they would call off-label, so it's tricky to get someone to pay for it, but that is one part that's available. Sesamet or Nabilone is available as well, so for chemotherapy patients that might have significant amount of nausea. And then in the US, they have a product called Epidiolex, so it's straight CBD oil, cannabidiol oil, and it is for pediatric patients with really resistant seizures. And I'm sure it'll be on the Canadian market anytime now. Oh, did I lose it? There we go. I did want to take a minute to talk about cannabis oil. Ooh, how am I doing for time? I'll be okay. Cannabis oil, this is a big question I also get in medSask about cannabis oil, and you can go to your health food store and pick up a bottle of cannabis oil. And how is that different? Can I be using this? Is it the same thing that I'm going to get from the licensed supplier, the regulated stores? And is it $100? Is it $60? What am I getting? As a consumer, you need to be very aware that there's several different types of cannabis oil that are on the market. So first of all, there's hemp oil. It's fixed, it comes from the hemp plant. And hemp is, the way that it's regulated in Canada, it's actually for manufacturing or industrial purposes. So they use hemp for its stalks, they use hemp in many different industrial processes. Hemp has a very, very small amount of CBD and THC. So it's less than 0.3% THC. So if you're using a product that's hemp oil, cannabis hemp oil, you're not getting THC and CBD in that product. You're getting fatty acids. So nutritionally, it's like taking a vitamin. Maybe not necessarily a bad thing, but it's certainly not cannabis or CBD and THC. Essential oils. So this picture is from Amazon because they sell cannabis oil on Amazon. This isn't the cannabis that you're thinking. This is cannabis that it's high in terpenes. So it actually is an essential oil. So people put it in they vaporize it, right? But more for the smell. It's not for therapeutic purposes. But some of the reviews on here, I read one, and it said that it was working well for a patient's symptoms, and it was also helping his dog with anxiety. So you gotta be careful. Cannabis oil is what you need to be looking for, and that's where you should see on the label. It should be labeled with how much CBD and THC is actually in that product. You want to be looking for that information. The other thing about regulation is that cannabis products now also have to have what's called an excise stamp, and I have a picture of it. If it doesn't have that excise stamp, it's not regulated by the government. It's technically an illegal product. It technically should not be being sold in Canada. It still is, absolutely. It's still floating around. I don't think a lot of people even realize that some of these products are illegal. The difference is that it hasn't gone through the same requirements that a regulated product has. So it could be contaminated. There could be fungus growing in that product. It may not have the amount of THC or CBD actually on it. And to me, if you're spending $200 on a CBD oil, but you're not guaranteed that it even has that CBD, I think you need to think twice about it. And then hash oil, which is absolutely recreational. It's very concentrated. Anyone that's watched any documentaries on Netflix with cannabis might have an idea of hash oil, but nothing we need to consider at this point. Contraindications, I think it's important for us to talk about it. So when we start to look at a patient that's considering cannabis, this is where, as healthcare providers and patients, we need to come together and start talking about the risk and the benefit. So what potentially is cannabis going to help me for versus what potentially could be a problem when I'm using cannabis. So there's certain contraindications that we have to be careful. Certainly anyone that's pregnant or breastfeeding, truthfully the science is a little bit shaky, but at this point from a public health perspective, it's recommended that you avoid cannabis products when you're pregnant or breastfeeding. Adolescents under the age of 25, the effect that cannabis has on a brain in a child is very different. Those brains are still developing so much. So cannabis can have an effect. I think it's important to consider personal history or family history of psychosis. So there's some studies suggesting that cannabis may be linked to psychosis. So we need to make sure we're well aware of that. Anyone that's had a previous substance use disorder, cannabis does have the potential for addiction or tolerance symptoms. So you need to make sure if someone has had a previous substance use disorder that we're well aware of going into a conversation about cannabis. And then this is where it's important that we consider individual patients. So chronic lung cardiovascular kidney disease, so THC and some of the cannabinoids can increase your blood pressure, they can change your heart rate. You need to be aware of that if you have cardiovascular disease. Older adults, so that endocannabinoid system that I talked about, not only does it change a lot in adolescents, so in those under 25, it also changes as we start to age. So our older adults need to be considered of that. And unfortunately, we don't have the science that says how it's going to change or what these cannabinoids look like in people as they're aging. Some of the studies are looking at aging adults, but we're just not there yet. And occupationally, you need to think about cannabis if you're working or driving. It's important to consider that there's certain laws and policies in place now, but you need to make sure that you're going into this eyes wide open. It's really only been legal for a couple of months. Medicinally, it's been legal for a lot longer, but you need to consider that. If you're someone that travels, snowbirds, for example, if you're going south for the winter, you're not getting your cannabis over the border if the state you're going to does not have legal cannabis, right? And in fact, you're not getting over the border regardless. Cannabis does not make it over the borders. Adverse effect, really, really busy slide. Once again, you'll have this when you get home. I pulled out a couple of the important things that I think we need to talk about with adverse effects when you're talking about cannabis products. So the first one is drowsiness and sedation. And with Parkinson's patients, we know that the medications already cause drowsiness and sedation. Important because adding on a cannabis product is going to increase the chance of that happening. I think that it's important to note some of the psychiatric changes, right? So this isn't necessarily talking about the euphoria. We know about the euphoria, but there's also been some anxiety or panic or hallucinations that have been reported, not just with THC, but also with CBD. I mentioned that CBD doesn't cause euphoria, but certainly there has been some behavior symptoms like aggression and irritation reported with CBD. Changes in heart rate and blood pressure, I mentioned those, important to be aware of that. And then the stomach issues. Once again, speaking to Parkinson's patients, we need to be aware that that CBD oil might be causing some stomach upset. And I've certainly seen this with people that are even on small doses that are sensitive to these adverse effects. And I think there's a certain sense that when something is a natural health product, or if it comes from a plant, that it somehow is free of those adverse effects or free of those types of problems, but that's not true. And in fact, 30% of the drugs that I have as a pharmacist behind my counter are plant-based products. So plant doesn't necessarily mean safer or fewer side effects. I put the no smoking sign, I've already talked about that. We need to make sure that we're not smoking this product. It's been shown to have the same potential cancer-causing effects. Even vaporizing, the research is still a little bit shaky. Those condensates, so the vapor that comes out might be cytotoxic. Still more research that needs to be done. I promised that we'd talk a little bit about tolerance, withdrawal, and dependence. Oh my, that's a Wizard of Oz theme. Once again, maybe with the cannabis field, we're a little bit in the land of Oz. So tolerance is possible. So that you find that as you're using cannabis products, that you might get used to some of the effects. And the reason I add this is because with opioids, we knew that people get tolerant to opioids. So when I first started out as a pharmacist, and we were learning about opioids, so codeine and morphine and those drugs, we learned that, okay, if you develop tolerance, you just keep bumping the dose up and you go higher and higher. Well, fast forward to the opioid crisis, and we know that that can't be, that's just terrible advice. So I think it's important that we're having this conversation about cannabis, because I don't want to be in the same situation in 20 years where I have people that are on high doses of cannabis products, and it's only because we said, well, just keep going, right? So I think that given what we know about opioids, I need to approach cannabis with eyes wide open. Withdrawal, so if you're on a cannabis product and you stop it, you can develop some symptoms of withdrawal. So taking it away, you might have headache, irritability, feeling unwell. That's not unique to cannabis. Many of the medications that you may or may not be on, you can have withdrawal on, but just make sure that you're aware of that. And sometimes it's that withdrawal that makes people think that they need to start using their cannabis. So because they feel when they stop using it, so maybe they tried CBD oil, they took it for a month and then, don't know if it's working, stop it, but start to have some withdrawal symptoms. It's not necessarily because they need the CBD oil because it was helping so much. It's that they're having a little bit of withdrawal, so you need to slowly decrease in dose. And dependence. So there is a diagnosis of cannabis use disorder, so people that are using high amounts, and it's problematic use of that. Higher incidence with people that start using it as adolescents. So that's why there's such a big public health push for cannabis products. Drug interactions, also important to talk about. And I have a couple of slides that talk a little bit more about some of the Parkinson's drug. Drug interactions with cannabis are a little bit of a gray area, because what the science is saying is that it's unclear. So potentially, there are a lot of potential drug interactions, but they haven't necessarily been proven in a research project. So some people will say, oh, there's no need to worry about drug interactions with cannabis, but the potential is there. So absolutely there is potential, and I think until we have a lot more research, we need to just make sure that we're aware of the potential for a drug interaction and monitor it. So this is where your healthcare professional, your pharmacist, your physician is important, because I'll make sure that when you give me your list of drugs, I'll let you know, okay, this may interact, here's what you need to watch out for. I don't know for sure, but we'll just make sure that you're aware of it. Two different types of drug interactions. Here's my fancy pharmacist words. One is pharmacodynamic, which means it's additive effects. So one drug causes something, whether it's an adverse effect or not. Another drug causes the same thing. You put those two together, and that effect is much greater. The other one is called pharmacokinetic, and what that refers to is how our bodies process these drugs. And there's certain things that can happen once we put a drug into our body that cause a drug interaction. Before I go on to the next slide, I do want to mention that smoking, whether it's cannabis or tobacco, does have drug interactions with some Parkinson's drugs. So ropinirole, selegiline, and misagiline, there are interactions. So if you are a smoker and you stop them, it might impact some of those medications if you're on those medications. Ooh, this is once again really small for people in the back. What I noted about Parkinson's drugs, so I looked at pretty much all of the different classes and everything that's out there, is that those interactions that happen between two drugs mixing and something happening in your body, there's not as much of a concern. So maybe with ropinirole and bromocriptine, we have to be careful that that combination could be a problem. Also with selegiline and misagiline, that could be a problem. The biggest drug interaction with Parkinson's drugs is actually those additive effects. So many of the medications that we use for Parkinson's have potential side effects of hallucinations, confusion, drowsiness. We saw the side effects of cannabis, which look remarkably similar to the side effects of these medications. You put those two together, and you might find that even though your medication was not causing problems with hallucinations or vivid dreams, now that you're taking a cannabis product, you might actually be having that. So you have to be very mindful of that. Quickly, we're going to talk about evidence. And when we talk about cannabis evidence, Big question mark. And the reason is, and this is where you get some pushback from physicians and healthcare professionals, because what we know about cannabis is nowhere near the way we have information about other prescriptions and other drugs that are on the market. So many of our cannabis studies are really small studies, so it's only a handful of people. A lot of these studies were done when cannabis wasn't legal, so the percents, like most of the studies are somewhere in the neighborhood of 7 to 9% THC. Well, now you're going out and you're buying it, and you know, it's 10, it's 20, it's 30%. Well, that looks really different. That's like taking 2 different doses of a product. A lot of the studies have been done in animals and in test tubes. So you can't always tell me that what happens in a test tube in a lab is what happens when I put that into a human body. That looks really different. They're small studies and they're really short. So some of these studies, like for chronic pain, for example, a good study in cannabis says that someone smokes cannabis and found pain relief. Check. That doesn't cut it. Like 1 dose of a smoked product in the medical world is just not enough information. So yes, it showed benefit at the time, but it was 1 patient, 1 inhalation. We need much more science behind it. The ones that we have good evidence for with cannabis right now, so patient-reported symptoms, so patients saying, hey, this actually worked for me for spasticity and MS. Chemotherapy-induced nausea and vomiting. So that's just not generally nausea and vomiting. That's people that are having nausea secondary to chemotherapy. So where I'm concerned about this is some of our pregnant moms who are considering cannabis for pregnancy sickness, right? So you can't say that because it works in a patient going through chemotherapy for their nausea, that doesn't mean it works for all types of nausea, right? Chronic pain in adults and certainly in seizures, so in that small group of resistant seizures. For Parkinson's disease specifically, we have very few studies and a really small number. My next slide shows you the studies that we have in Parkinson's disease. And just to give you an idea, for cannabis, the total patients right now, it's about 180 when you look at the studies that are done. So if you think of, I looked at an exercise study in Parkinson's patients, 800 patients. If you look at a study that, it took a whole bunch of studies together, and it looked at when you add a medication to levodopa. 44 studies, 8,000 patients. So when I say that we have very limited evidence, our cannabis studies, 180 patients, right? And it's like opinions. Sometimes when you get one person's opinion, it doesn't mean as much as when you get many opinions. It's the same thing with evidence. We need to get evidence from many people to be able to say that this is actually going to work. So there's my studies, that's what's available, 180 people. It's very mixed, so some of the studies say it worked, some of the studies say it didn't. Small numbers, so 9 patients, 6 patients, 2 out of 7 patients said that it worked on their motor symptoms. So you can see that there isn't really a lot out there. Now, having said that, anecdotally, or just people talking, that first study was actually a survey. And so they looked at people that had been using cannabis. And I've seen anywhere from 20 to 80% of Parkinson's patients have tried cannabis. When they did a survey of those people, and this is patient-reported, 31% of patients said that it worked on their tremor. 45% said it worked on some of their motor movements. But you have to remember that that's patient-reported. And we know the placebo effect, so me giving you something that actually has nothing in it, has an effect 30% of the time. So that's why it's important to have really good studies done so that we know if that number is a realistic number or if it's just people saying, yeah, I think it helped. Part of me as a pharmacist, though, I believe in the placebo effect. And for a patient that has tried everything and nothing is working, if it helps you and it's not causing you harm, there's a lot to be said for that. And that's why I like to talk about cannabis, because there are absolutely some considerations, but I need to make sure that it's not going to potentially cause you harm before we consider those benefits. What about CBD? I call CBD my magic bullet, because everyone thinks that CBD is the solution to our problems. And I just don't think we know yet. So I think there'll be more coming about CBD. What's very interesting is the potential prevention role for CBD. I think that's tricky with Parkinson's because unfortunately Parkinson's is diagnosed well into the disease. And so to take something preventatively is going to be very tricky, but there might be a potential role for that, so stay tuned. Some of the other symptoms, so certainly anxiety, sleep, and depression, other things that Parkinson's patients notice. What I've found with cannabis is that it's what they call biphasic, and to explain that, whether it's for anxiety or sleep, low doses have one effect, and a high dose has the exact opposite. So you might find, say for something like sleep, THC, high dose of it, it's actually causing sleep disturbances, whereas low dose, it might actually help. Same thing with CBD. Higher doses of CBD might help. Some of the lower doses, we didn't necessarily see that. Same thing with anxiety. So a lot of patients that are using high dose of these products, it's actually causing anxiety. It's causing paranoia. It's causing delusions. So we have to be very careful with cannabis, and this is where I think that we need further research to really say whether it's going to work. Some really interesting things about anxiety and CBD coming, so once again, there might be more information. One of the studies I read was they gave CBD to people presenting publicly, and I thought, well, that's interesting. Maybe one of these days I'll try CBD before a presentation, see if it makes a difference. And then depression is actually really poorly studied. We know that the endocannabinoid system, so that body system that we have, is very involved in regulating mood, but we just don't know the effect that it's going to have yet. So a lot of work that needs to be done. And at the end of the day, if you look at guidelines and what's kind of out there, it's really not recommended due to a lack of evidence. So we just don't have enough to say that what it's going to do for you is better than the potential harm that it might cause. So when are you going to actually think about cannabis? So like I mentioned, I think that in a patient where you have tried everything and you have gone through all of the traditional medications and all of the evidence-based science, and you're just at your wit's end, absolutely. When your goal of therapy is symptom relief. So it's a little bit different than when I actually need to target a cholesterol level with a cholesterol medication. If you're looking for some symptom relief, cannabis might work, because once again, I had mentioned that sometimes it's just the fact that you're taking something that might help. And if you balance the risk of your benefit, if you balance the benefit with your risk of harm, cannabis might be an appropriate option. If you are considering cannabis, the SMART goals is one of the things I use as a pharmacist. So make sure that you go in knowing what you can potentially expect from that medication and set goals. So make sure that you have realistic expectations. So if you're using cannabis for chronic pain, for example, make sure that you're well aware of, okay, it may work, it may not. Let's see. Instead of, a lot of our scales say rank your pain on a scale of 1 to 10. So you might want to use that. So my pain coming in is a 9. So in 4 weeks, let's talk about this again. Is my pain less than that? Is it a 7 out of 10? Is it a 6 out of 10? What's more important for me too, I think, is that we talk about some functional goals. So for something like pain, let's say your pain was really limiting your mobility and you could only walk maybe from here to the middle of the room. In 4 weeks, let's talk about it. Are you walking farther now? Can you actually move better? Is that helping with your chronic pain? So it's important to have some really realistic goals. I think it's important to involve family and friends and caregivers in this process, because sometimes they will notice things that you won't identify. So if you're having maybe you're a lot more paranoid after starting cannabis, you might not notice that. But I bet you my husband will notice that in me. So it's important to involve our caregivers as well. So set some realistic goals and continue to reevaluate. And I wish we did this with all prescriptions and with all medications. Let's talk about this med. It's 6 months, at 1 year. So many times we start a prescription and we just keep going and we keep going and we keep going. I think that SMART goals are applicable not only to cannabis, but to so many things. Okay, harm reduction. Cutting into my question time. I'll just skip over that. I'm going to go right to access. Harm reduction just talks about making sure that you're keeping cannabis in a safe place, right, away from pets and kids. Some general common sense information. Access, I've mentioned it several times throughout the presentation. I advocate accessing the medicinal side of things. So the Cannabis Act, legally you can access cannabis through the Cannabis Act. It was formerly called ACMPR. So speak to your physician or a healthcare provider about getting authorization to use it through the medical stream. I think it's important to have a healthcare person on your team so that you can have those conversations about whether it's working and what it might be causing as far as harms go. So I encourage you to access it. That stream, at the very least, make sure you're accessing a product that has been regulated. So that's an example of the excise stamp on the far left. That should be on all of your cannabis products if you're using a cannabis product. As far as references and resources, I actually really love the Health Canada information. Any conspiracy theorists in the room are probably saying, don't follow the government, but no, the Government of Canada has done an excellent job of providing resources. There's a document on their website called Consumer Information. It has a lot of the information that I spoke about today. And our Government of Saskatchewan has some good information on their website as well. Ooh, I talk fast when I'm running out of time. medSask, once again, we're a drug information resource, so if you have questions, certainly give us a call. Oftentimes you're going to end up talking to me, so we can chat about your cannabis questions and hopefully give you some good answers and good information. I think it's important to continue to spread this information, especially because there is a lot of misinformation that's out there. That's it, that's all. Sorry, that's not a lot of time for questions.